Hi, my name is Lei Lim, your lead pharmacist who specializes in weight management. Today, I'm here to tell you how to safely inject Mounjaro, which is a medicated injection that contains tirzepatide, which helps with weight management. Tirzepatide lowers body weight and body fat mass by mimicking two different types of hormone, GIP and GLP-1. It decreases food intake through the regulation of appetite and modulation of fat utilizations. It also slows down digestion so that you feel fuller for longer. This means you eat less and have fewer cravings, which can lead to more effective weight loss. The medication comes in the form of injection pen, which to be injected quickly. Each pen contains 4 doses, which means each pen will last you for 4 weeks. Now, let me show you how to use the pen. Your parcel will come with some needles, some alcohol wipes, and a sharp bin to dispose of your used needles. Step 1. Make sure you have a clean surface and clutter-free surface for your pen. Then wash your hands with soap and water or alcohol gel. Step 2. Choose your injection site. You can inject into your upper thigh, your abdominal, or your upper arm. Clean the chosen area with an alcohol wipes and let it dry. You should always use a different injection site each time to avoid any soreness or bruising. Step 3. Remove the cap and keep it aside. And check the expiry date, dose of the strength, and the color of the medication. It should always be clear and with a tint of yellow and should never be frozen or cloudy. Step 4. Wipe the inner seal of the pen with one of the wipes. Next, you will need to attach a new needles. Remove the paper tab of the new needles and then attach it to the pen. Step 5. Before you use the pen, you will need to prime it. To do this, remove the outer cap, followed by the smaller inner cap. The dose selector is at the end of the pen. Turn the dose selector until you hear 2 clicks. With the needle pointing upwards, tap the cartridge gently to collect some bubbles at the top. Release some medicine into the air by pressing the dose selector until it stops. Keep pressing while you count to 5. The 0 icon will be shown in the dose window. Priming removes the air from the cartridge and make sure that your pen is working properly. Your pen is primed if a small amount of medicine comes out of the tip of the needles. There's always slightly more medicine in the pen than is needed, so you can prime every dose. Step 6. Turn the dose selector until it stops, and the 0 icon in the dose window will now turn to 1. Pinch an area of your skin gently and insert the needle at a 90-degree angle. Press and hold down the dose selector until it stopped and count to 5 while holding the dose selector. The 0 icon should be visible in the dose window before removing the needles from your skin. If you don't see the 0 icon in the window, you have not completely administered the dose. In this case, just insert the needle back in your skin and finish your injection by pressing down the dose selector. You should not redial the dose. Step 7. Put both caps back on the needles and unscrew them from the pen. Dispose of the needle in a sharp container. Recap the pen and store it in the refrigerator. If you're unable to refrigerate them, you can store them in the dry place away from the direct sunlight with temperature below 30 degrees. Thank you for watching. If you have any further questions, please reach out to me. All the best!